Ovarian cancer accounts for 6% of cancer-related deaths in women. Survival rates in the UK are the worst in Europe, with most cases presenting late when treatment is less effective. All women over 50 or with a family history of cancer can now have a simple screening test, quite literally saving lives.
This is a hugely important subject. What does the ovarian cancer test involve?
Basically, it involves having an ultrasound scan where they do an internal scan to have a look at the woman's ovaries, and also a blood test to measure a tumour marker called CA125. Currently there's a large NHS trial which is partway completed, which has already shown that you can identify ovarian cancers at a much earlier stage if you have regular screening. But it's going to be some years before that's available as an NHS service.
So how long does the test take and how often should somebody have this test done?
The scan and the blood test take about 30 minutes, and we would advise people having it done every year.
Why is that?
What you really want to do is to identify ovarian cancers in the very early stages before they've actually spread outside the ovaries, and we know that if you pick them up at that stage, that early treatment gives much better cure rates.
And tell me, Bryan, why is this particularly important for you, this subject of ovarian cancer screening?
Well, unfortunately, I've had two very close family members who were diagnosed with ovarian cancer, one who died and one who's currently unwell at the moment. And the problem is that by the time it actually is picked up, treatment doesn't really make a big impact.
The reason ovarian cancer screening is important to me is because my mother died from ovarian cancer when I was 10 years old. I've wanted to do all that I can to look after myself and to minimise my risk, if you like, not knowing whether her death was an isolated event or whether it was the beginning of a trend or in the midst of a trend, because we're not sure grandmother-wise or further relations back. There is no NHS-based screening programme for ovarian cancer, and it's not something that you can readily check yourself in the same way that you can check yourself for breast cancer, or you can pop along to your GP surgery every 3 to 5 years for your cervical screening. So the opportunity to have ovarian cancer screening here, I leapt at with both hands almost, because it was the first opportunity I had really. And it stops the inbuilt worry, if you like, which is at the back of your head, wondering, you know, what if this is me? What if this is going to be my fate? I believe that all women should have access to ovarian cancer screening, whether that's over 50 or if it's a younger age, if they feel that they've got a strong familial link. I know that there is a trial going on, but I think services like this at Innermost Secret, where you can come along yourself and take the initiative in your own hands, I think is vitally important for anybody who's worried about this.
With the availability of regular annual screening, you can pick up these cancers early and treat them. And so a family doesn't have to lose a mother or a sister or a daughter. And with early treatment, the survival rate is better than 95%.